Stop. Don't just listen to this video. Do something with it. Sit up, focus for a second, and ask yourself honestly, when was the last time your body felt strong, warm, fully responsive? Because if you just watch and scroll like everything else, nothing changes. I've spent over 30 years working with men in their 60s and 70s, and I thought I had seen every pattern: low energy, poor circulation, restless nights. But a few years ago, something happened that caught even me off guard. I started noticing the same symptoms in myself: cold hands in the morning, that heavy fatigue that doesn't go away, waking up at night more than I used to. And the strange part, I was doing everything right, including taking zinc. That's when it hit me. Not suddenly, but slowly, almost uncomfortably. I had been focusing on the wrong thing. I tried different supplements, adjusted routines, even doubled down on what most men are told to take. Most of it didn't move the needle. What surprised me was how many men misunderstand what's really happening inside their blood vessels after 60. It's not just aging, it's a silent breakdown in how your body controls blood flow. And in this video, I'm going to walk you through the exact vitamin most men overlook, and a few others that work together in a way most people never realize. And the fourth point is the exact vitamin I want to focus on today. If you're curious where this comes from, I've left more details down in the description below. Before we go deeper, let me ask you something simple. How old are you? I read every comment, and it really helps me understand who I'm speaking to. Now, myself. Let's start with the first point, why it might be time to forget about zinc and what your body actually needs instead. 1. The real problem. After 60, it's not zinc. Before we talk about supplements, I want you to try something simple starting tomorrow morning. Drink a full glass of water, then take a slow 10-minute walk right after breakfast. No phone, no distractions, just steady movement. It sounds almost too basic, I know, but this one habit quietly activates blood flow in a way most men overlook. What surprises many of my patients is that this isn't just light exercise. It's actually triggering your blood vessels to open and respond again. Here's what's really happening inside your body after 60, and this is the part most people miss. Your blood vessels are lined with cells that control how wide or narrow they become, and those cells rely on a compound called nitric oxide to function properly. As you age, your body produces less of it. Your vessels stiffen, and circulation slows down, which is why you feel colder, more tired, and less responsive overall. Studies have shown that even light post-meal walking can improve blood flow efficiency by around 15 to 20%, simply by reactivating this nitric oxide pathway. Now here's where it connects directly to what you're feeling. When circulation drops, everything downstream suffers. Your brain gets less oxygen, so you feel foggy, your muscles fatigue faster, and the pelvic area, which depends heavily on strong blood flow, becomes noticeably weaker. That's why so many men tell me, "Doctor, I still eat well, I still move, but something feels off," because the issue isn't effort, it's circulation. And this is why zinc doesn't solve the real problem. Zinc supports certain functions, yes, but it doesn't restore blood vessel flexibility, it doesn't boost nitric oxide, and it doesn't repair the underlying vascular decline. What you need is something that works at the level of those blood vessels themselves, improving both circulation and overall energy at the same time, a dual benefit that builds gradually with consistent daily support. If you start with that simple routine, hydration, movement, consistency, you're already laying the foundation. But here's the part most men never realize. Even when you open the pathways, your body still needs the right signal to keep those vessels functioning properly, and that's exactly where the next piece comes in. 2. The core biological mechanism. Now let's go one layer deeper, because this is where everything starts to connect. I want you to add one small step to what you're already doing. After your morning walk, step outside and get 10 to 15 minutes of direct sunlight on your skin, preferably arms or face, without sunscreen for that short window. It sounds almost too simple to matter, but this is one of the most powerful ways to activate a biological system your body depends on. In traditional medicine, this was described as restoring vital energy through light, and modern science now explains exactly why that works. Here's the central mechanism most men over 60 are unknowingly losing: your body's ability to produce and regulate nitric oxide. Sunlight exposure helps trigger vitamin D synthesis, and vitamin D plays a direct role in activating the enzymes that support nitric oxide production inside your blood vessels. At the same time, movement increases blood shear stress, which further stimulates those same pathways, creating a synergistic effect between sunlight and physical activity. One study showed that adequate vitamin D levels were associated with up to a 30% improvement in endothelial function, while another found that combining light activity with proper vitamin D status improved vascular responsiveness by over 25%. Now here's the risk factor most people ignore. When this system declines, it doesn't just affect circulation, it creates a cascade. Blood vessels stiffen, inflammation builds quietly, and over time this increases the risk of hypertension, cardiovascular strain, and reduced oxygen delivery to critical tissues. In traditional Eastern perspectives, this would be described as stagnation, where energy and blood no longer flow freely, leading to fatigue, weakness, and decline. And when you combine low vitamin D levels with a sedentary routine, that decline accelerates much faster than most men expect. So here's exactly how to implement this properly. Start with 5 to 7 minutes of sunlight exposure if you're new, especially if your skin is sensitive, and gradually build up to 15 minutes over 1 to 2 weeks, ideally between 8 a.m. and 10 a.m. Pair this with your 10-minute walk and a breakfast that includes healthy fats, because fat helps your body utilize vitamin D more effectively once it's produced or supplemented. This combination creates a consistent daily signal that tells your blood vessels to stay open, flexible, and responsive. But here's where it gets even more interesting. Even when this system is activated, many men still don't feel the full effect, and the reason lies deeper at the cellular level where your body produces energy itself, and that's exactly what we need to look at next. 3. Why zinc falls short, breaking the old belief. Now let's address the belief most men hold on to: zinc. I'm not here to say zinc is useless, but I want you to try something different starting today. Add a nitrate-rich source like a small glass of beetroot juice or a handful of arugula to your lunch, and pay attention to how your body feels within hours. It sounds simple, almost too obvious, but this targets a compound your body actually uses in real time: nitric oxide. Unlike zinc, which works slowly through indirect pathways, dietary nitrates convert into nitric oxide through a step-by-step process that begins in your mouth and finishes in your blood vessels. Here's the process in plain terms. Nitrates from foods are converted into nitrites by bacteria in your mouth and then into nitric oxide once they enter your bloodstream, which directly relaxes and widens your blood vessels. That means better circulation, faster oxygen delivery, and a noticeable change in how your body responds, sometimes within just 2 to 3 hours. In controlled trials, nitrate supplementation has been shown to improve blood flow by up to 20% within hours and increase exercise endurance by nearly 15% in older adults after just a few days of consistent intake. Now compare that to zinc. Zinc supports hormone balance over time, but it doesn't directly increase nitric oxide, and it doesn't produce that immediate vascular response. This is why many men take zinc for months and feel little difference in circulation or performance. With nitrates, you're not waiting for a slow hormonal shift, you're activating a direct pathway your body can use right away, while also supporting long-term vascular health when used consistently. Some men worry about taste or mild side effects like a slight drop in blood pressure or a feeling of warmth, but these are often signs that your blood vessels are actually responding and opening up. If you're new, start with 100 to 150 milliliters of beetroot juice in the early afternoon or a serving of nitrate-rich greens with your meal, and avoid using antibacterial mouthwash right before because it disrupts the conversion process. Over time, this creates both a fast-acting boost and a cumulative improvement in circulation. But here's the deeper layer most men never consider. Even if you improve blood flow quickly, your body still needs a stable internal signal to maintain that effect throughout the day, and that signal doesn't come from nitrates alone. It comes from something working at the hormonal and cellular level, which is what we're about to uncover next. 4. The main solution, vitamin D3. Now, this may sound a little unusual at first, but I want you to combine two things starting tomorrow. Take your vitamin D3 with a warm, fat-containing meal and then sit in natural light for a few minutes right after. It sounds almost too simple to matter, but this pairing creates a stronger biological signal than most people realize. You're not just taking a vitamin. You're activating a pathway your body depends on to control blood flow at multiple levels. Here's the deeper mechanism. Vitamin D3 doesn't work alone. It moves through your body and influences gene expression that controls nitric oxide production, calcium balance, and vascular relaxation. Through intermediates like endothelial nitric oxide synthase, it helps your blood vessels stay flexible while also reducing inflammatory signals that cause stiffness and narrowing. This affects not just large arteries but also microcirculation, the tiny vessels that supply oxygen to your nerves, skin, and pelvic tissues, which is why men often notice less numbness, warmer hands and feet, and faster recovery over time. Clinical data supports this more strongly than most people expect. Men with adequate vitamin D3 levels have shown up to a 30% improvement in endothelial function, and in some trials, microvascular circulation improved by over 20% within several weeks of consistent supplementation. That translates into real-life changes. Less tingling, better sensitivity, improved healing, and more consistent physical responsiveness. Now, here's exactly how to do it safely and effectively. If you're new, start with 1,000 to 2,000 IU per day for the first week, taken with your largest meal that contains healthy fats like olive oil, eggs, or avocado, then gradually increase to 3,000 to 4,000 IU, depending on how your body responds. Take it earlier in the day, ideally in the morning or early afternoon, because it aligns better with your natural rhythm and improves utilization. Temperature and digestion matter more than most people think. A warm meal enhances absorption compared to taking it cold or on an empty stomach. One important note, more is not always better. Excessive dosing without monitoring can lead to imbalance, so it's always wise to stay within recommended ranges or check your levels if possible. But when used correctly, consistently, and paired with the right conditions, vitamin D3 becomes one of the most powerful tools for restoring circulation both at the macro and micro level. And yet, even with better blood flow and stronger vascular signaling, many men still feel like something is missing because circulation alone is not enough if your cells don't have the energy to use it, and that's where the next and possibly most powerful layer comes in. 5. How to use it plus the mistakes most men make. This may sound a bit strong, but for the next 7 days, I want you to stop taking your vitamin D3 the way you've been doing it and restart it with intention, timing, and structure. Don't just swallow it and move on. Take it with your warmest, fattiest meal of the day. Sit down and give your body a few minutes to actually absorb and process it. It seems like a small change, but this is where most men lose over half of the benefit without realizing it. Here's the deeper reason why. Vitamin D3 is fat-soluble, which means it relies on bile acids and digestive enzymes to be properly absorbed, and without enough dietary fat, it simply passes through your system. Once absorbed, it's converted into its active form through the liver and kidneys, where it begins influencing nitric oxide production, calcium signaling, and vascular relaxation through intermediary pathways. When this process works correctly, you improve both large blood flow through major arteries and microcirculation in smaller vessels, which is why symptoms like numbness, cold extremities, and slow healing begin to improve. Research has shown that taking vitamin D3 with a fat-containing meal can increase absorption by up to 50%, and consistent daily intake has been associated with a 20 to 30% improvement in endothelial function over time. But here's the mistake. Many men take inconsistent doses, switch forms, or take it on an empty stomach, which disrupts the entire process. Another common issue is starting too high too fast, which can lead to discomfort or imbalance. So here's how to do it properly. Start with 1,000 IU daily for the first 5 to 7 days, then gradually increase to 2,000 to 3,000 IU as your body adapts. Always pairing it with a meal that includes healthy fats and ideally some warmth, because digestion is more efficient when your system is not stressed or rushed. Avoid taking it late at night as it may interfere with your natural rhythm, and always stay within safe ranges unless guided otherwise. Now here's the key point. When you do this correctly, you're not just improving circulation, you're restoring a system that compounds over time, getting stronger week after week. But even then, there is still one missing piece, something that determines whether your body can actually use that improved blood flow effectively, and that's where the final, most powerful layer comes in. 6. Timeline of results, the habit that locks it in. Now let me show you what I consider the most effective way to lock in everything we've built so far. A simple daily addition that many of my patients overlook because it seems too ordinary. I want you to prepare a small cup of warm cocoa each evening, not the sugary kind, but pure unsweetened cocoa mixed with warm water or milk, about 70 to 80 degrees Celsius, and drink it slowly after dinner. It sounds simple, but cocoa contains a unique group of compounds called flavonols, which directly support nitric oxide and microcirculation in a way that complements everything we've discussed. Think of your blood vessels like roads that have been narrowing over time, and nitric oxide is the signal that opens those roads. Cocoa flavonols act like maintenance workers that keep those roads flexible and responsive. Studies have shown that regular cocoa flavanol intake can improve blood vessel function by up to 30% within a few weeks, and in some cases, microcirculation improved by nearly 40%, which is comparable to certain pharmaceutical interventions, but without the same burden on the body. That's why men often notice warmer hands, less tingling, and faster recovery in tissues that used to feel sluggish. Here's how to do it properly. Start with 1 teaspoon of pure cocoa powder in the first week, then increase to 1 to 2 teaspoons daily, always in the evening when your body is shifting into repair mode, and keep the temperature warm but not boiling to preserve the active compounds. Make it a routine, not a one-time fix, because the real power comes from consistency over weeks, not hours. And this is the part I want you to hold on to. Your body is not done. It's simply waiting for the right signals. No drugs, no expensive protocols, just science-backed habits that work with your biology, and when you combine them, you're not chasing quick fixes anymore, you're rebuilding something that lasts.